Hello, we are going to take a quality improvement article and we are going to put it into the non-research evaluation template. But first, a quick reminder about QI. Sometimes it does look like research, but you have to remember that QI is a data-guided, it's a systematic data-guided activity, but it's designed to bring about immediate improvement within a clinic, a hospital, a system, whatever. This is what we were talking about, internal or local knowledge. It's the internal evidence. With research, the intent is to create new knowledge and to generalize it to the entire population. When I say that, I mean the entire population, like similar places, the UK, the United States, whatever. So that's the difference. Research is new knowledge. QI is taking that knowledge and putting it into practice in a local environment per se. And I think just sometimes students ask me that just because statistics are utilized, that does not mean it's a research project. You have to still evaluate, and we use mathematics oftentimes to do that. So the other thing too is people said, well, QI with research has to go through ethical review. It absolutely does, especially in healthcare system. It's a way to track it. Generally, QI projects are exempt, but they still have to have some ethical review. IRB oversight will occur if there is national or federal funding, such as NIH, or if you are randomizing, doing a control group and another group, the intervention group, for a QI project, and that is done sometimes. And so that's a specific research component. And then if there is increased risk to patients with a QI project, you're going to have IRB oversight, but most QI projects are exempt, but they still have to go through the IRB when it comes to bigger healthcare systems. They should go through it. Okay, so let's look at the table here very quickly. Citation, it's the same way. It lists your authors, your date of publication, and your title. So back to the question of QI versus research, you need to really look at the information that you are provided with in Canvas, such as the CHOP link. But this article is nice because, it says it's a QI improvement, okay? And it goes through the abstract. I'm going to make this a little bit smaller. It takes you through the introduction, which is your background, and gives you an idea of what the problem is. Then we talk about project design implementation. That's usually the way QI projects are. Because remember, with research, it's a research methods. You have your methods and you have research design and all those types of things. So these should give you some pretty good cues besides the fact that it said it's QI project, but that it is different. Okay, so this is really nice because this abstract tells you specifically what the purpose is, okay? And when you read this, it says the QI project was to successfully implement a nurse-led evidence-based practice change, which was designed to reduce CODIs in 2 units. As you read through this, the background, the intro and the background, then it tells you the 2 specific aims. One was to improve patient outcomes through reducing CODIs, but the other was to for nurses to utilize and comply with the catheter nursing rounds and the nurse-driven catheter removal algorithm or protocol. As you read through this, you will see that this protocol was actually implemented a year prior to this QI project, but people really weren't following it. So if we go back here, I cut and pasted it, and then I kind of changed it up. I put both of the aims there, reduce the CODIs, and then to increase adherence to the nurse-driven protocol. Okay, so review questions. You may or may not see these if it's relevant. There were no review questions, but this is my table, and I wanted to make sure that my memory was, I could tug my memory if I needed to about what the heck were they looking at. And what I wanted to put in here, and this for myself, hang on here, was that the author did, the author did examine and discuss several QI projects that were conducted similar to this QI project. So this is really, it says here, include types of studies reviewed. I just wanted to make sure that I had some of that information in, and it was in fact, yes, they did talk about how they reviewed other similar or like QI projects. Okay, so was this a rigorous peer-reviewed process? Well, usually this is applicable to clinical practice guidelines and expert consensus guidelines. But one thing they did do, which I thought was very important, and it's in here somewhere, is they did go to the IRB for the hospital. It was kicked out as exempt, but they did do it, and I can't find that right now. So I did put that in here. I put yes, they did access the IRB. It was exempt. And to me, that's very important, okay? I did put in here, it's not really applicable, but again, I wanted to be able to refer to it somewhere. The peer review process, this wasn't really technically, or I use this term loosely for this QI project. They did use the CPCDA model, and this is a five process or a 5-step process. But what's cool throughout this whole article is that they really communicated. There was two-way communication throughout this whole 9 months that they designed and implemented this project. So to me that was very important because they knew who their stakeholders were. They identified them in the article, and then they went back and they really talked about that two-way communication. Okay, and let me kind of go there. So with project design, let me see here. Oh, here is the IRB. Project procedures were reviewed and considered exempt by Duke University and the implementation site. So that's your ethical oversight. But when we talk about the 5 steps, here we go, the 5 steps evidence-based model, they talk about how they had the skills fair, they educated nurses, they developed rounds, they received feedback, they gave feedback, but they also received feedback from end users and the unit director. So this was an open communication. So not technically peer review, but I thought it was important that they really worked closely, very closely, and they talked about it with these stakeholders. Okay, so let's go right back here. Recommendations, were guidelines or recommendations valid, reproducible, through the data search, expert consensus, independent review, and current. Again, this isn't really truly applicable to this project, but they did talk about how adherent they had. They actually had adherence to the protocol or the algorithm, and that was noted in the outcomes. And so I guess here for the end I did put nurse-led interventions influence patient care, and support from the top is critical, because that was really what came out of this as a recommendation per se. But by the way, this right here, this is a huge clinical, this is huge for clinical practice and clinical significance. Okay, so appraisal of worth. They talked about this. This is about strength and limitations, and then the applicability to clinical practice question and professional practice. And again, I go right back to this. This was huge for me anyways when I read this article, when we talk about practice question and the professional practice. That's what they found. And yes, the other thing they also found was that this process did reduce the CODIs, and so they were very successful with this QI project in meeting both of these, addressing both of these aims. Okay, so the strength of this was, in my opinion, was they did replicate similar QI projects. So they really looked at the evidence out there, and you can look at the references as well. They accessed and looked at studies, and they used a proven evidence-based model, and this model did align with the goals of what they were trying to achieve. Okay, and they also wanted to look at sustainability, and this project actually ended up going over 9 months. A limitation was that it was single site, but that is what it is. It was 2 units in 1 hospital, and that's okay. I mean, we recognize that's a limitation. That's a given. The other strength was the meaningful communication throughout the project. I kind of mentioned that before, and I believe that they did it right. The algorithm, by the way, didn't change, but the behavior did. So as you read through this, they really talked about bringing this protocol back, and they educated them on the protocol. They did a skills fair. So here it is, the existing evidence-based nursing algorithm or protocol. They really talked about it here. They developed nursing round sheets. So they went through it specifically, and they really did a lot of different things to be able to make this behavior change. And it proved effective. So that was very, very nice. The strength of the evidence and the quality of the evidence, it's a 5 because it's a QI project. And this goes back to that Johns Hopkins evidence-based table that you are to use in your Canvas course. And the quality evidence, I gave it a B just because it was a single site. You'll go look at the criteria. But that's okay. It is what it is. Okay? So if you have any questions, make sure to ask your instructor.